And we are live, ladies.
Hi, everybody. Thank you for joining us today on our Learning Curve Summit. I want to thank Jeanette Trumpeter, who is here again to do our moderating. Thank you, Jeanette. And today's special guest is Ann McDowell, and she is a, as I said earlier,
epidemiologist.
Thank you for saying that, with the Public Health Department. Thanks, Jeanette.
I even looked up to make sure I knew what I could define epidemiologist. I can't
Epidemiologist.
say it, but
yeah, if I say it really slow, epidemiologist, I can get it out. But yeah, anyways, Anne, thank you so much. So much.
Of course, I'm happy to be here.
So I'm going to get things going. First of all, we just want to explain what this is. This is another Learning Curve Summit sponsored by the Pismo Beach Chamber of Commerce. And we all know we are living in new, not normal times with the COVID-19 virus in our community and all kinds of other things happening. But for the focus of this meeting, it's to talk about what our new normal is like, what's happening with our trends. And we have a great source of information today, again, from San Luis Obispo County Public Health, Ann McDowell, who is an epidemiologist. And I looked it up, Ann. It's the study and analysis of the distribution patterns and determinants of health and disease conditions in a population. So you are like a rock star right now, because everybody's looking for answers of what this all means. So if I could just get you to kind of start with where you think we stand right now. We are seeing increasing numbers, but at the same time, we're opening up some of the restrictions.
Okay, well, first I want to address the whole epidemiologist thing. It's funny, my family says, you know, we used to have to tell people and explain what you do, and now everybody knows what you do, and they all do it better than you. So there's a lot of armchair epidemiology going on out there, and I appreciate it because people are really engaged right now. They really understand the importance of what it is to see disease spread in a population. And quite frankly, we've been spoiled for many, many years where we have vaccines that have prevented the spread of communicable disease for quite a long time. And there's just no way to stop this particular disease until we get a vaccine or everybody has had it. So there's two ways to look at it. And right now we're really seeing a lot of disease. So we're trying to reopen. We fully recognize that simply telling everybody to stay home, don't work, and shut down all businesses is not a successful path forward for society as a whole. Very few people, I think, can afford to just huddle up in their homes and spend a lot of money that they're not making and not have a business or a job. So this is the big reason why California is slowly reopening and slowly trying to get business going. But the results are what we're seeing. Higher numbers. We have 389 cases as of today. And just from a South County perspective, we're seeing a lot more cases in South County, and we're not surprised at all by that, unfortunately. I look at outbreaks from an epidemiology standpoint, and we have what we call amplification events. So, you know, if one person is sick and goes to a big party, and then, you know, a bunch of more people get sick, just because there was a lot of people that were able to be exposed to that one person. And so we saw our cases rise initially, and then we closed down and we saw it go down. And then right before Easter, there were hardly any cases. And somebody said, oh, is it over? Are we done? And I said, yeah, talk to me 2 weeks after Easter. And so sure enough, we saw, you know, a little bump because people wanted to, you know, they want to go to church, they want to see their families. And this was a moment where they could do that. So we saw a bump after Easter, and then people started obeying and clamped down again. And then we started to see very low numbers. And then Memorial Day came, and I said, well, boy, in 2 weeks after Memorial Day, we're really going to see some action. And sure enough, here we are, a couple weeks after Memorial Day. The state is slowly opening. We're still in what's called stage 2, and we're starting to see our case numbers explode. So this is what's going on. I have bad news. They're starting to go up in South County too. You know, really one of the hot spots in our county for a long time was Paso Robles, but now we're starting to see it in South County, in Arroyo Grande, Pismo Beach, Nipomo, Grover Beach, these places, they're starting to get more and more cases. So that's where we see ourselves now. I think that we as a society are willing to accept right now that we have to go back to work, that people have to support themselves. They've got to earn money. They've got to be able to stay in their homes, and they've got to be able to run their businesses. But the flip side of that is it means that, yes, more people are going to get sick.
So what, I think in the beginning, we were all glued to the briefings that were happening 3 times a week, and you could kind of get the answers of why things went up and went down. Over the last week or so, we've seen some more numbers. Do you know if those, I saw that some were traced to one family and I think it was a Mother's Day gathering. Do you have any kind of insight on that as to that could lessen our concerns or make us pay more attention to those numbers as far as where these increased numbers over the last few days have come from?
Well, if you look on our, if you look at where there's readyslow.org, I hope everybody knows about readyslow.org. I hope that everybody knows there's a lot of reopening guidance for businesses there on readyslow.org, but there's other places where you can get sort of detailed statistics about what's going on in the community and what we're looking at from cases by region, cases by age, how much lab testing we're doing. But if you scroll way down, there's something called mode of transmission. And we're sort of breaking it out into a couple things. One, if you went traveling, and that was sort of the early part of the pandemic where they said, oh, if you'd been to China, if you go to LA, if you go to San Francisco, you're going to come home with disease. And then we have person-to-person mode of transmission. And that's because we're doing contact tracing. We call every single person who gets a positive test and we say, hi, we're here with the public health department. Who have you contacted? You're sick. Do you know anyone else who's sick? Give us a list of everyone you've contacted. And then we place the people who are ill in isolation, who have tested positive. And if they know anybody else who's ill, we offer them free testing here at the public health department. We test them. And so we've identified quite a few people as through person-to-person transmission via our contact tracing. And that's what we're supposed to be doing right now. Finding people who have been exposed, telling them to stay home, and then giving them a place where they can come and get tested immediately if they have any symptoms. And then we have what we call community transmission, where we're really unable to figure out where they got it. We can't trace it back. They didn't go anywhere. They don't know anybody who's been a positive case, and they just became ill and they went somewhere to get tested, and we found out about it, and we're their first contact, and they're like, wow, I'm surprised. I don't know where I got it. I didn't go anywhere. Well, I might have gone a few places. It's the community transmission that we're worried about, not so much the person-to-person transmission. If I can find a large gathering and I can identify everybody who was there and put them in quarantine and tell them to stay home and call us the moment they get any symptoms, we've got a handle on that. It's the people that we cannot figure out where they got it that worries us the most. They're the ones that just went out for a stroll somewhere or stopped off at a store or went someplace that they won't tell us about and got sick. And that's what is the biggest problem we see. But the majority of our cases we've identified to be through person-to-person transmission, which is good. It means that we're out there doing the contact tracing and trying to get people who are ill or who've been exposed to stay home and not spread the disease any further.
What about, I know I was kind of thinking the same way that you kind of mentioned it over Memorial Day weekend when seeing the crowds out in the beaches and the gatherings and thinking, oh dear, like 2 weeks from now, wait till we see the numbers. And then the numbers weren't all that alarming. Were you looking at that same thing with the protest? I mean, I looked at the protest and yeah, a lot of people were wearing masks, but I certainly expected some uptick from the protests. Have you been able to track whether those have led to an increase in numbers?
We are not seeing that. We really aren't. We're seeing far more in just out and about. In fact, I would say that cases that have mentioned being at the protests are negligible in our case counts.
Wow.
It's really person-to-person transmission and community transmission where people are out and about. Memorial Day and the opening of the economy is associated with far more cases right now than protests.
So what about that? I feel like there are two very distinct schools of thought. I run into people, some neighbors that still haven't allowed a person into their house to use the restroom, and others that are hosting gatherings and going to bars and restaurants and dancing and listening to bands. And um, it just seems like there's really two clear. I know there's lots of schools of thoughts in between as well, but it does seem like there are just two polar opposite feelings about this pandemic.
So here's the thing. If you look at our numbers, we look really good in this county.
Right.
Sorry, there's another conference going on, so you might be hearing some noises in the background. We have tragically had one person die from this disease in our community, and we see other places in the state which have far higher death rates from infection to COVID-19. And what we're hoping is that we don't see that happen here. There are a lot of people in our community who have contracted COVID-19, not had to stay in the hospital, gotten better, recovered, and go about their lives. And there are some people who have been in the hospital since April. And we now have 9 people in the hospital, and 4 of them are in ICU. So we're starting to see our hospitalizations tick up, and we're starting to see some very serious complications of COVID-19 in some of our people. For a lot of the younger people, it's true. There doesn't seem to be a huge risk of serious complications from this disease. But for a significant number of people who are over the age of 65, or people who have immunocompromising conditions, people who are on drugs that suppress their immune system, people who have chronic kidney disease or chronic lung disease or chronic cardiac disease, there's a very good chance that they will have serious complications from this disease. And these are the people we need to protect. So I'll be honest, if I was 20 years old, I would probably be thinking, yeah, right, I don't need to worry. I'm going to be fine. I'm healthy as a horse. I can go do what I want. But for a lot of people, that's not the case. And I'll be honest, I'm not 20 years old anymore. And I'm in a higher risk category now. It's just simply because of my age. And so there's a reason to think that, for some people, it's a big risk. And these are the people we have to protect, because I don't know anyone in my life that doesn't know somebody who's over the age of 65 or has some kind of medical condition that could lead them to worse disease. So if you're 20 years old and you know for a fact that you're never going to contact anybody who's got any underlying medical conditions, maybe you feel pretty secure going out and having a good time. But that's not everybody in our community.
So we're talking to Ann McDowell. She's the epidemiologist for the San Luis Obispo County Department of Public Health, and a very important person always, but definitely commanding our attention and our respect during the COVID-19 crisis, when there are just so many questions. And what she does is study disease and the way it moves within populations. So we welcome all questions. To those of you watching, if you'd like to type a question, I'm keeping an eye on the feed here. Thanks to those who have announced that you've joined us. And one of the things that we obviously want to talk about today, or I would like to talk to you about, and by all means, Lisa, jump in with any questions you have, but the governor's mandate that the state, that all people should be wearing masks statewide. To this point, Penny has been sort of recommending it, but it wasn't mandated. Cities have kind of implemented some sort of guidance, but it hasn't been as strict as what the governor put out today. So what do you think about that? Is this going to help our numbers by having people wear masks more?
I'm not sure if that question was for me.
Yes, it is, Ann, sorry.
Yeah.
Okay, sorry.
It's the same question I had.
Yeah, we hope so. But if you look around, you'll see that there's a certain segment of the population that doesn't really care what we tell them to do or the advice that we give. And they wander around in the community and they're like, yeah, that mask thing, that's not for me. I don't need to worry. I don't need to care. And so these are the people I worry about. I'm hopeful that wearing a mask when you're outdoors or indoors. Now, you'll note that the governor's order said that if you're outdoor for recreation and you're keeping social distancing, you don't need to wear a mask. So, if you're on a hike on Cerro San Luis and there's nobody around you, you don't need to be wearing a mask. You don't need to wear a mask if you're the only person in your car or in your car with your family. But if you're out and about other people, you need to wear that mask. We hope that that will slow down the transmission of disease. And there are some studies out there that show that it does in fact lower the transmissibility of a disease. We always worry about something called R0 or R0, and I don't know if you've heard that. It just means if I'm sick, how many people am I going to spread the disease to? And we're looking at this disease and saying, in really bad conditions, it can be up to 2. And you think, well, if you only spread it to 2 people, that's not that bad. But it's that whole thing of if I get a penny one day and 2 pennies the next and 4 after that and 8 after that, you're a millionaire in under a month or something like that, right? So an R0 of 2 is actually quite bad, but they're showing in studies that if you wear a mask, that number drops. You're transmitting to significantly fewer people, and that's what we're looking to do, is reduce transmission of disease. And we have high hopes, actually, that if you do wear a mask, that will happen.
Talking again to Ann McDowell, she's the epidemiologist for the San Luis Obispo County Department of Public Health. There were some whispers. I didn't see anything on readyslow.org, so I assume it's a bit of an urban legend, but I'm going to go ahead and have you address it if you don't mind, that maybe the COVID-19 virus moved through this area prior to the big outbreak, and that's why our numbers were so flat, and we've enjoyed a relatively flat curve compared to other areas. Is there any serious talk about that maybe this came through earlier for us?
So I don't want to get too technical, but we actually had just an amazing opportunity. We sent as many samples as we had in our lab off to a genetic sequencing group. And they did genetic sequencing of the RNA of all the samples that we had and sent us back what's called a phylogenetic tree, which shows sort of how the RNA has mutated over time. And I can assure you that all of our seed strains came from China. And I mean, that's the progenitor, right? That's where it started. And then it sort of spread across different areas of the world and got introduced. And you could see sort of the small number of mutations as it walked its way across the globe and into our community. And no, we didn't have an outbreak of disease before everybody else. We definitely had diseases that were sort of downstream in the mutation tree that showed that the disease was started in China. The ones that are in our community moved through Europe, moved through New York, moved through San Francisco, and got here. And the seeds of infection that have arrived since then have all been downstream of those big events.
Fascinating, fascinating. We have a question from Darren. Do you have the influenza death numbers for our county last year and this year so far? I obviously may be looking for a comparison of their influenza numbers compared to our COVID numbers. And
okay, Darren, I'm going to answer that question because you can't see my screen, but I'm going to have to pull up a file here first. So give me a couple minutes and see if you have any other questions you want to ask first.
Yeah, Lisa.
I have a question for you, Ann. So we've had a lot of visitors here in Pismo Beach. If a person goes home to wherever they're from and they get COVID, are we alerted since they were just here visiting? Do we know that possibly, like if they were at a specific hotel, are we alerted for any of that stuff in our county? Oh, did I lose you, Ann?
Ann, are you still with us? Did we lose? We might have lost her.
I'm sorry, are you here?
Yes, you were here.
Okay, sorry. I'm multitasking right now. So what will happen is if the other counties are doing contact tracing, so they'll get somebody sick and they'll find out that they have contacts here in our jurisdiction, so they'll notify us of those contacts, and we'll reach out to those contacts and alert them that they're a contact of somebody who's been diagnosed with COVID-19, but they don't necessarily have to tell us that somebody was in our county. If that person doesn't list our county as having contacts in it, then they don't necessarily have to tell us.
What if they had just been to a restaurant? They'd gone to a hotel restaurant. Would you be notifying the restaurant so that do you go to that extent of contact tracing?
If somebody tells us that they've been to a restaurant, then we'll call and tell the staff. But we don't generally release that information to everybody at this point.
Gotcha. Were you able to find the numbers on influenza?
Hang on, I'm making my selections now. So they want 2019 and 2020, but I'm actually going to go all the way back to 2018.
Fantastic. Again, we're talking to Ann McDowell, who is the epidemiologist who studies disease and its patterns for the County of San Luis Obispo. She's taking time for us today in this summit that we're trying to do periodically with the Pismo Beach Chamber of Commerce to answer your questions as we all try to adjust to the new normal that will exist probably until we get a vaccine, which will be my next question for Ann when we give her a chance to answer this one. And by all means, everybody watching, we encourage you to let us know you're here and let us know if you have questions.
All right. Are you ready? In 2018, we had 13 deaths due to influenza. In 2019, we had 8. And so far this year, we've had 8.
So far this year, the flu is still more deadly than COVID-19.
That's correct. And obviously, the numbers on this year won't be complete until we go through November and December. So we don't really know what's going to happen in November and December, whether or not it's going to be a bad flu year. I think I speak for the entire health department that we are down on our knees praying that it is not a bad flu year and that we are encouraging everybody to get a flu shot this year, because if COVID-19 turns out to have a seasonality about it and turns out to be worse in the fall and winter, that in conjunction with a bad flu season would fill up our hospitals. So we want to make sure that everybody gets a flu shot this year and we reduce transmission of flu as much as possible in case COVID-19 really comes roaring through in the fall and winter.
Gotcha. And we don't know that yet, right? There's no firm speculation even on that?
Well, generally we look to the southern hemisphere. They get a flu season before us, so we'll look down everything below the equator and see what their flu season was like and see what strains of flu were circulating. And that's actually what we base our flu vaccine on, is the strains that are circulating down there. They've had a rather strange flu season this year because they've been practicing extreme social distancing. So we're really unsure what a flu season will look like and how it will spread this year. Certainly when we first started all this disease this year, we had a lot of people still in the hospital back in March from flu. And all the social distancing just stopped the flu season dead in its tracks in this county, which was really nice. And we went from hospitals that were at 80% capacity to empty in a very short order because we stopped spreading flu. And so we certainly hope that that's the case this year too, but you never know. So,
Lisa, do you have any questions you want to pipe in so I don't dominate this?
No, the only thing with that comment I was thinking is it'll be really nice if people will continue to wear our mask and wash our hands and continue that even during the regular flu seasons from now on. I mean, it would just help the spread. So to me, it kind of makes sense that could happen. I was going to ask Ann another question. So as far as gatherings, I know that wedding venues are going to be opening soon. Is there, do you know how many guests will be allowed, or is there a cap on that as of right yet?
So when we were looking at these venues, it's much like church and movie theaters, 25% of capacity or 100 people, whichever is less.
Mhm.
We really want people to social distance, and that's very hard at these big celebrations of life. I know it was very hard. This was graduation, so think of all the seniors who are graduating from high school or getting even out of middle school, who are graduating from college, and they were thinking they were going to have this big party and everybody was going to come celebrate with them. And I think that's very hard to miss these big sentinel events in your life and not have a lot of friends and family around to celebrate with you. And even when loved ones pass and you cannot get together and grieve together, that's a very hard thing as well. But we want people to take the most precautions they possibly can to do this in a manner that does not make people sick. So weddings, yes, people can get married, obviously, but your wedding reception, maybe a smaller wedding reception. We live in a beautiful area of California, perhaps an outdoor reception would be the best way to go at this point.
For sure. And we have a question from Manny. His question are the increased numbers of cases this week a result of more testing or increased spread of the virus? So are our testing numbers going up continually week after week still? Is that parallel to the increase in cases, or are we just seeing more cases?
We've been doing more testing for the past month, but it's only in the past week that we're really seeing our numbers start to shoot up. And what we also pay attention to is not just the sheer number of people who are tested, but the percentage of people who get tested who are positive. And so we are seeing that positivity rate rise. So yes, more people are getting tested in the past month, but what's been happening in the past week and a half or so is that the percentage of overall people who are getting tested is rising who are positive. That means more people are infected in the population and more people are spreading the disease.
Uh, I know that you don't have the ultimate answer, but do you have a personal sense of what you think has led to our increased numbers? We've talked about that the protests really haven't shown to be the instigator of that. Do you have a sense of why they're going up in the last week?
I live in Grover Beach. Yes, I have an idea of why. I went to the beach and I left the beach because it was packed. And I just saw people, with their wagons full of goods heading down to the beach. And I drove through Pismo and it was packed with people. And I look around at restaurants in SLO and South County, and I see people are out and about and the area is packed. And this is not the case several weeks ago. So I think that what we're seeing is a lot more social interaction and a lot more spread of disease.
So as our epidemiologist, your recommendation is to slow our roll a little bit. I mean, I know even I just had a conversation with my mom this morning and she said, "What does your weekend look like?" And I said, I think I'm going to go hunker down for the weekend because I've kind of loosened my restrictions enough. And when I start adding up the numbers of people I've had contact with over the last week, I kind of just want to have a clean start, a week from now and know that the odds are I'm clean. So we all are lowering our guard, and what I'm hearing you say is that, yeah, we all need to keep in mind that this thing's still out there.
It is, and it's so easy to fall back into a pattern. If you want to go out to eat, sure, go out to eat in a place where you can probably sit outdoors at a reasonable distance from everybody else. You should be eating with people who are in your own household or eating 6 feet away from anybody who's not in your household. And it's just a matter of doing it responsibly and in a socially distant manner. I don't want people to lock themselves away in their homes. That's not going to be a successful way for us to move forward as a society. But there are people who are at risk that need to be very, very careful before they step out into the stream. And if you go to a restaurant and you haven't been out for 2 months, it's very easy to go, yay, I get to dine out again. I get to act just like normal again. Oh, thank goodness I'm back to normal. Everything's wonderful. It's not. The restaurants are open. You can go shopping, but you still have to be very aware that you can catch a disease that can have serious complications while you're out there, and you need to be taking precautions. And as unpopular as this mask ordinance is bound to be in certain communities, I think it's a good idea moving forward to help prevent the spread of disease.
Great. What about, I've heard about the different blood types and that certain blood types are more susceptible to, I don't know if it's the disease itself or the complications that can come with the disease. Can you address that at all?
I can't. I haven't really read any studies that show that. I have not seen a single study that says, X many people in the hospital had this blood type and X many who didn't go to the hospital had that blood type. Nothing that's peer reviewed and credible has come out talking about that.
Another urban legend that's been tied to this. And so again, once again, we're talking to Ann McDowell, who's the epidemiologist for the County of San Luis Obispo Department of Public Health. We welcome your questions. Just type them in on the Facebook feed here. And I think that's a really valid point. You mentioned readyslow.org, and to folks who are not checking that on a every other day basis, you should. There's just so much information there that's fact, and there is so much misinformation that is being spread on social media and websites, and they look official and they sound credible, but fact check it with your own county's source of factual information. So I appreciate you setting that straight for us. Lisa, anything that you would like to ask?
No, I just read, I think it was yesterday, that we had a large number of cases that were in some of the nursing homes. So I don't know, I was wondering if that helped bump up our numbers also, if it's more of the nursing homes where people are closer together. And then it made me wonder, well, if a lot of nursing homes are closed down from visitors, how did it get in there in the first place?
Well, we've seen this. Sadly, we're seeing it across the country in nursing homes and any place that's a congregate living situation. I'm sure if you cast your eyes southward and look at Lompoc Prison, you've heard the reports and seen the reports about the sheer number of people that have been infected and died in Lompoc Prison. Anytime you put people together in large, dense areas, you just pack people in together. Anybody who comes in who has the disease, it's a really good area to spread it around in. And so we do know that staff at these institutions, prisons, skilled nursing facilities, they're the ones that are going in and out. I'm not saying that family members coming in can't spread it as well, but we do know more and more family members are going to visit their loved ones because it's just awful not to be able to see your loved ones in this time. And so it's, mentally important for people to see their relatives and loved ones, but we have to do it in a socially distant manner. And so occasionally a staff member might become incidentally infected outside. They went to the store or they went somewhere and didn't even know it and became infected, and they go to work and maybe they aren't that sick. And then suddenly a couple of the patients get sick. And we know that this is a tremendously vulnerable population. These are people who are all older and many of them have chronic disease. And so this is why you see such high rates of death when COVID gets hold in a skilled nursing facility and spreads. And certainly we have had some cases in skilled nursing facilities, but not a tremendous number. Thank goodness, knock on wood, throw salt over your shoulder, whatever you want to do. And we're investigating them as fast as possible. If we find one staff member or one patient in any of these places, we go in and we test everyone. We test all the staff, we test all the patients. We've gone into CMC because they had some cases. We tested everybody in that quad of the prison. We tested all the prison guards. And then we come back 2 weeks later and we test them again, because that's the infectious period. And we want to make sure that anybody who may have been exposed but didn't test positive the first time, we want to make sure that 2 weeks later they're not now infected. So we're doing everything we can to slow down the spread of disease in these very vulnerable populations.
So are there some people that could actually be walking around with COVID and not even realize, because maybe their symptoms are so low, or they're not having breathing difficulties? Maybe they just have a slight cough and they don't realize that is COVID. Is that possible also?
It's not the majority of people, but I can tell you that I've heard several times, what? I'm positive? I don't even feel sick. I just got tested because, or I was a contact and so I thought I'd just get tested, but I had no idea I had COVID and I had no idea I was sick. So yes, are we getting people who are absolutely asymptomatic or don't have any symptoms who are testing positive? Yes, we're seeing that. And we know that when you're positive, you can spread even if you're not having symptoms.
What about someone who has had the virus and, you know, been determined to have
Oh,
it's through their system and they've recovered? Is there an assumed immunity there, or are they vulnerable to another strand? And I guess that's a two-pronged question. Is this like the flu where next year we'll get a whole nother strain, even if we do have a vaccine?
That was actually that was a triple.
Yeah.
So,
Sorry about that. Let's start with the first. Is there an immunity if you've had it? Are you immune from getting it?
we assume that there is a certain immunity if you've had the disease. How long does that last is a different question.
Hmm.
Um, so we assume it lasts several weeks or months at the very minimum. But we do know that this is what we call a coronavirus, which I think you'd have to be living in a hole not to know that it's a coronavirus at this point. And we know that there are other coronaviruses out there that we regularly detect in people, but don't seem to have this level of severity. And we do know that people can catch them more than once in their lives, but there's generally a period of time between that. So does it offer some immunity to reinfection? Yes. Can you be reinfected? It's possible, but we haven't really seen that yet. Probably because not enough time has passed. And the third question was, can you get it again next winter like the flu? The flu is one of the most highly mutagenic viruses we know in the virus kingdom. It changes a lot and really fast. So we get that flu vaccine every year because the virus changes so much between years. We do know from studying other coronaviruses that the viral envelope around this particular around coronavirus is much more stable than the flu. It doesn't mutate as much. And even though I was talking earlier about how we see in our phylogenetic tree certain mutations, not a single one of them has been shown to be a critical mutation in enough so that it changes the virus so much that your immune system wouldn't recognize it and fight it off. So we don't think we're going to see a radically new, slightly changed COVID-19 come roaring back in the winter that's different enough that it reinfects everybody. The possibility of that seems very low at this time.
Fantastic. Lisa, anything on your end?
no, but that's good news.
Very good news.
Yeah.
What about the antibody test? Are we close to having that accessible? And I know that on the early strains of it, or whatever, the early versions, that there was some expression that they probably weren't that reliable. Where do we stand with the antibody testing?
So the FDA, the Food and Drug Administration, is really trying to make sure that we can detect this disease. And so instead of putting a lot of our tests through what they usually do, which is a very rigorous process, they've pretty much issued emergency use authorizations, for almost any test. And that's what all the antibody tests are out there under right now, is just these EUAs that have come flying out. If you have an antibody test and you submit some data to the FDA, they said, yes, go ahead, go do it. Do we know how reliable they are? Some are more reliable than others. We know that pooled antibody testing is better than just single antibody testing. So your body's immune system has a number of different antibodies that it puts out in response to any infection and any disease. And we're learning that if we're testing for antibodies, if you're testing for a bunch of the different antibodies that are in your body, it's more sensitive. That is, it's more likely to pick up the disease. And it's more specific, which means it's more likely not to give you a false positive. So we want a test that's very sensitive. It'll pick up the fact that you're infected, and that's very specific. It'll pick up the right disease, and it won't give you a false result. We know that the pooled antibody testing is the best way to go, but there are a lot of antibody tests out there that do not, in fact, use a pooled sample and can yield either false positives or false negatives. And the FDA and the CDC at this point are saying, if you test positive via an antibody test, then go get the nasal test, go get the PCR test, which is basically a genetic probe looking for the specific RNA in a sample to verify that you've been ill. That having been said, we consider somebody a probable case if they've had that antibody test and they were symptomatic or were a contact of somebody who was a lab confirmed case.
So is the county offering antibody tests yet?
Absolutely not.
Okay.
We investigate the antibody positive people. If you get an antibody positive test, you're most likely to get a call from us that will ask you about your symptoms and were you ill and did you have contact with a known case. But for the most part, we really are just chasing after the ones and only offering the tests that are RNA specific.
And the reason you're not doing those tests is because you don't feel like they're reliable, or they're just too hard to get?
It's a couple reasons. First of all, we want a very sensitive and specific test and a very reliable test before we would do antibody testing. Right now, the public health lab is turning itself inside out. They're doing heroic work right now to test as many specimens as they can. They have launched multiple new tests to detect this. They have set up new testing protocols. They've brought in new equipment to be able to increase our capacity to test. And us launching an antibody test isn't even on our horizon, just trying to get the testing and the new testing that we have that we know is reliable going and making sure it's available to the community.
Gotcha.
So, and do you recommend that everybody takes a test? Is the county recommending that everybody has a test taken?
You mean just for the virus itself?
Yes.
Yeah. So if you're out and about, yes, we recommend that you get tested. If you have been locked up in your house for the past 2 months and don't talk to anybody and haven't gone anywhere, and you're asymptomatic, I wouldn't really recommend that you run out and get tested. You're probably more likely to run into somebody who's infected in the test line than you have been just doing what you've been doing, which is staying home and protecting yourselves. If you're out and about a lot, or if you've been around people who are sick, or if you know some people who have been sick and said, oh yeah, I was diagnosed with COVID-19, or you go to a large gathering and you develop symptoms, we absolutely want you to go get tested. If you have any symptoms, and initially the testing criteria was, oh, you have to have a fever of 100.4. We now know that that fever symptom is spotty at best. People say, yeah, maybe I had a temperature of 99. It might have gotten up to 99.8. Maybe I topped 100, but just having a fever is not the single most important part of being diagnosed with COVID-19. We certainly see people who say, I just was so exhausted and my muscles hurt and I had the worst headache. And that's the symptoms I had. And so we know that there's a variety of symptoms that go with this disease. So if you're having those symptoms, then yes, please go out and get tested.
We did have a comment here from one of our viewers that said, visiting Pismo was a huge eye opener. In my county, we only need masks in Costco, and numbers have spiked here at home in the last week. So it just is a testament that good practices are helpful to all of us. And it is hard because I think we all are kind of quarantine weary, and summer's here and we're heading into the longest day of summer here within the week. And we haven't had a chance to go explore it like we are used to. I have one more question that gets asked. The Paso numbers, any philosophy on why Paso Robles has seen such, not dramatically higher in the whole scheme of things, but significantly more than a lot of the coastal communities, as to why there might be more cases there?
Well, we see good testing numbers in Paso, but we also see some areas where there's very dense housing and more poverty, and people, we see this in New York, we see this in Chicago, we see this in LA. If you have high density housing and people who are crammed together, then you're going to see more disease transmission. All it takes is one person in a very dense housing environment to spread the disease to a lot of people. And it's happened multiple times at this point.
Yeah, got it. Lisa, anything before we so appreciate this, you joining us today. It's just fascinating to have such a smart person with us to be able to answer our questions and separate fact from fiction. Lisa, any last minute questions for Anne?
I don't have any questions, but Anne, I really do thank you for your time in coming on our learning summit for today. It's been very informative. So thank you so much.
Yeah.
Of course, I really, I know that there's just a tremendous amount of curiosity about what's going on right now. This is unprecedented in our lifetimes. The last big pandemic was 100 years ago, and that's the one we have been all worried about in public health. I've been in public health for 20 years now, and that's, what we measure everything against is the 1918 pandemic. And here we are 100 years later, and this will go down in history as somewhat similar to the 1918 pandemic, as just how broadly it impacted our society. And so I know that people are just like, well, what's going on? I don't understand. And I really want to be able to get out there and answer people's questions so they understand what's going on and why we're so concerned. We don't want to see a significant portion of our vulnerable populations placed in hospitals, so that if somebody who's not as vulnerable has a heart attack, there's no room. We really want to make sure that we keep our population just as healthy as possible. And I think that we all have a role to play in that.
I'm going to put you on the spot. One last question for you, Anne. Would you head to a bar this weekend or a restaurant, knowing what you do about the coronavirus? Would you feel comfortable heading into a social situation like that if you don't really have to?
I don't think I could say no strongly enough. I would not head into any bar or any restaurant right now, seeing the behaviors that I'm seeing. There are just too many people who are just too happy to relax the social distancing at this point. And I think I mean, I don't want to cast aspersions on any groups, but San Luis Obispo has had very low numbers for several months, and we've done such a good job. I am so proud of the people in this community for really adhering to social distancing, to staying home, to lowering the risk. And I live in South County, and I've seen a tremendous number of people coming over from the Valley that are not practicing good social distancing at all, who are running around without the masks and who are sort of glancing askance, I sometimes feel, at the rest of us in our community because we're trying so hard. We're wearing our masks. And I don't want to go anywhere out there where I see a lot of people who could care less about the vulnerable people in our community, and they're out there to have a good time. I simply don't want to take this home to my family, and I don't want to spread it around in my community.
Wow, that's profound. And that is a good lesson to all of us that, we still need to practice the safe practices whenever we can. And it's really tough, I would assume, for business owners who want to be open and want to welcome people into their businesses, but having to balance, boy, can you stand 6 feet behind the next customer, please? And can you please respect what we've been trying to do as a community, and even within our own community? I know there are people that feel differently, and it's an interesting time we're living in, and it sounds like we're going to be living with it for months and months and months. So thank you so much for just spreading the truth for us and helping us understand what our new normal should and is going to look like.
I'm happy to do it, and I just want to direct people one more time to readyslo.org, readyslo.org. It's a great resource for the community and for business owners. There's a lot of great guidance on there for business owners who want to open up in a responsible and safe manner, which we believe in most cases can be done. And there's a lot of information out there for the community as well. And you can track the cases and see what's going on in your community. And so just want to put in another plug just for what we're putting out there so that you can be an informed consumer of your health news.
Yeah, for sure. I just put that up on the feed so that anyone watches this not live, when it's just posted on Facebook, we'll see that too. And again, thank you so much, Ann McDowell, who is an epidemiologist for the San Luis Obispo County Department of Public Health. We know your job has just been crazy. And like you said, something you've probably studied for most of your career, you're actually living right now. And all that hard work you've done is coming into play for, unfortunately, a tough reason, but we're certainly glad we have somebody like you where you are and with our Department of Public Health, and appreciate all the leadership that's come from the county on this.
Oh, thank you. I hope you both have a wonderful afternoon and a wonderful weekend, and that everybody here stays safe and stays healthy.
Thank you very much.
Thank you so
And
much,
thank
Ann.
you all for joining us. Lisa, as always, thanks for having me as inviting me to the party, so to speak. And we will, this will be on the Facebook page after
Now.
we finish wrapping it up now. And you have a great
Yep.
day. And thank you all who took time to
Thank you,
join us.
everybody. Have a great day.